How the heck do you get rid of those pesky little white bumps called closed comedones that pop up on your forehead, elsewhere on your face and body? In today's video, I'm going to be sharing with you my top tips and tricks for closed comedones. I'm going to be going over what you should avoid if you deal with closed comedones, and make sure you watch to the end because we're going to be talking all things skincare ingredients and the top 5 skincare products for closed comedones. What exactly is a closed comedone? Closed comedones are commonly referred to as whiteheads. They happen when your pores get clogged up with a combination of oil and skin cells that get stuck together. Some people have a genetic tendency towards oilier skin. Their skin just makes more sebum. And of course, sebum, oil production, is also influenced by your hormones. But when it comes to closed comedones, one of the main driving factors is the cells that line your pore. They kind of don't mature as efficiently as they could, and they get stuck together in a little plug that, combined with the oil, leads to a whitehead. Now, if you deal with blackheads, don't click out of this video because you're going to be surprised to learn that the tips and tricks that apply to whiteheads also apply to blackheads. Blackhead is basically the same thing as a whitehead. The only difference is that that little plug gets exposed to air and turns black, and that is what distinguishes a blackhead from a whitehead. Comedones are typically painless. They don't itch. Sometimes they're not obvious when you look straight on at your face, but if you turn to the side, you can see little bumps. Comedones are a skin lesion that constitutes acne. Now, there are different types of acne. Some people have acne that is very inflamed, painful, cystic, and they get these large nodules, whereas other people have acne that is purely comedonal. Comedonal acne is hormonal acne. Why? All acne is hormonal. If we remember back to the beginning of the video when I explained why you get these, part of the reason has to do with oil production. Guess what governs oil production? Hormones. So even if you don't have big inflamed cysts, there is a hormonal component. Comedonal acne can get a lot worse around your menstrual period, if you become pregnant, or during menopause because the hormones change. In some cases, very oily hair care products can aggravate the formation of comedones, especially on the forehead and the sides of the face. So if you use products in your hair that are like styling mousses and gels and things, there is some idea that they get on the skin and form a film that further perpetuates comedone formation. One thing that you will hear frequently recommended to always choose non-comedogenic products, but I have to tell you, there's not a lot of good science behind this claim that products are comedogenic. The majority of studies that we have on comedogenic ingredients comes from rabbit ear models, where it's very unrealistic, and those ingredients don't actually end up being truly comedogenic in real world use. Skincare products may exacerbate comedone formation, but there's nothing about a product that predicts if that is going to happen or not. When it comes to skincare products that aggravate this condition, it's very individualized. That being said, you may prefer products labeled as non-comedogenic because they do tend to be a lot more lightweight in consistency and not feel oily or greasy on the skin. And as I said, a lot of people who have comedonal acne, they have an oilier skin type. These products tend to feel a lot more comfortable to them. In the literature, you'll find an association between more stubborn acne and higher consumption of either skim milk and or whey protein. But many people consume milk, skim milk, dairy products, whey protein, and have no issue with acne, and their acne is not any worse or better eating these foods or leaving them out. I say more research is needed because there are some possible confounding factors in these association studies that need to be further teased out. Association does not prove causation. The other dietary factor that plays a role in acne likely is the consumption of processed, refined, sugary carbohydrates. That's not to say you can never eat these foods, but they may play a role, especially if that constitutes the bulk of your diet, because these foods do lead to an increase in insulin-like growth factor, and they are inflammatory. Insulin-like growth factor is a hormone that can lead to more oil production. If you have been subsisting off of processed junk, you know, regardless of acne or not, it's probably not the best thing for you. And introducing more whole foods into your diet, you may notice an improvement, although honestly, you may not. Diet studies and acne, we need more research. The other thing you want to avoid if you have comedonal acne is picking, squeezing, or attempting to extract closed comedones. You're not likely to get anything out, and you're just going to bring a lot more inflammation, and that's going to put you at risk for scarring and for worsening of your acne as a whole. Some comedones are amenable to extraction, typically after a patient has already been using a topical or oral medication that is is comedolytic and softens the glue between the stuck together skin cells in the pore. And at that point, once everything is soft, then it's a lot more amenable to extraction. But I always suggest strongly that you leave that up to the hands of the professionals, because the last thing you want to do is scar yourself. How do you tell the difference between closed comedones and fungal acne? Fungal acne is a popular term for something called pityrosporum folliculitis. And you're right, it can look similar to comedonal acne. Pityrosporum folliculitis, in contrast to closed comedones, has nothing to do with the formation of a plug in your pore, but rather it is due to inflammation in the hair follicle caused by Malassezia yeast. The way to tell the difference between closed comedones and fungal acne is to first and foremost see a board-certified dermatologist. But some clues are that when it comes to closed comedones, they're typically painless and they are not itchy, whereas fungal acne, aka pityrosporum folliculitis, is typically very itchy. Pityrosporum folliculitis, you're going to have little red itchy bumps that all look the same, whereas closed comedones are skin colored and they're not itchy, they're painless. With comedones in general, you may also have open comedones, blackheads. With pityrosporum folliculitis, you're not going to have blackheads. However, be aware that some people, especially if you live in a humid tropical environment or you have maybe been on a medication that weakens your immune system, some people actually can have both at the same time. But again, leave it up to the professionals to figure out what exactly you have going on. Don't try and be your own diagnostician. You probably clicked into this video because you want to get rid of closed comedones. How do you get rid of them? Nothing is going to get you results overnight, fast. It takes time, it takes patience, it takes consistency. One of these may do it for you, or you may need to use one or two alternated in your routine or paired together. We'll get into all that in a moment. But many people can clear their comedonal acne and prevent recurrences by staying consistent with a skincare routine that involves products that they buy over the counter without a prescription. FDA approved acne medications that you can get without a prescription. Salicylic acid. Salicylic acid is an ingredient that loves to get in your pore, and it goes in there and it dissolves the glue between the sticky skin cells in the pore, that plug. It helps break that up. And it also helps calm down some of the inflammation. Now, there are a variety of different forms of salicylic acid: gels, creams, lotions, moisturizers, leave-on products. I also am a fan of just introducing a salicylic acid cleanser. Now, recently I did a video all about the benefits of salicylic acid face wash. One of my favorites is the CeraVe Acne Control Cleanser. It has 2% salicylic acid and is fragrance-free. This also has niacinamide, which is helpful for reducing oxidation of sebum. And it also has hectorite clay, which is going to help absorb some excess sebum from the surface of the skin and from within the pore. And then as you rinse off the lather, that goes down the drain. Now, this product you can introduce into your routine using it 1 to 2 times a day as tolerated, morning and or evening, depending on how you tolerate it. Many people tolerate using it twice a day just fine, whereas for other people that may be too drying. You may want to do it just once a day. Lather it to the entire face, sparing around the eyelids, because it can be very drying around the eyelids. Leave the lather on the skin for a few minutes, let it really soak in, and then rinse it off. Through something known as coacervation, the salicylic acid in this can be left behind on the skin surface while the other cleanser ingredients are rinsed off, along with the oil on your skin. So this is a great option and a great place to start. Some people can clear up and prevent their closed comedones just doing that, but that's not going to be the case for everyone. The second ingredient that is great for comedonal acne is a retinoid. Over the counter, you can buy adapalene, which is FDA approved for acne, and a comedone is part of acne. Different Gel is a brand name, but a lot of other brand names out there, brand name options, even most of the drugstores these days now have their own generic version of adapalene. Any of those is going to be just fine. I just happen to have Different Gel here. Now, this works different from salicylic acid. This is a retinoid, so it gets into the skin and it binds to receptors to influence how cells that line your pore behave so that they mature more efficiently and you stop getting those plugs. You stop getting those comedone plugs. Some people are able to use a retinoid like Different Gel at nighttime, and that alone helps them to clear up their comedonal acne, whereas other people benefit from having this in the evening, and also maybe incorporating a salicylic acid face wash 1 to 2 times daily. I can't predict for you what's going to be best, but just know that these are options. Your dermatologist also may prescribe you a retinoid. So if, depending on your insurance, that may be covered by your insurance, so you don't have to pay with your own money for adapalene gel, which you can buy over the counter. That's great. Other retinoids include tretinoin, which I have a lot of videos on, tazarotene, which I have videos on. Then there's also the newer retinoid trifarotene, which I also have a video on. So check those out if you want to learn more about all the different types of retinoids out there. But yes, a retinoid really can help with comedones, and you've got a great over-the-counter, FDA-approved retinoid for acne that you can use for closed comedones, adapalene. But adapalene and other retinoids, as you know, are not recommended to be used during pregnancy. They're safe in breastfeeding, but not pregnancy. Check out my video on retinol in pregnancy. I go into the reasons why in that video. But there, it's something that you're not supposed to use if you get pregnant. So I often get questions, what's an alternative to retinoid for closed comedones? Now, you can use salicylic acid face wash in pregnancy, provided you're just using it to a small area like your face or maybe your upper chest. But retinoids are not. So what's an alternative to a retinoid? A really good ingredient for closed comedones is actually azelaic acid. Azelaic acid you can buy over the counter or you can get with a prescription. The prescription stuff is stronger. The research that we have backing up azelaic acid as a comedone buster is using the prescription stuff, but you can get good results using the over-the-counter stuff. One of my favorite azelaic acid products is from The Ordinary, their azelaic acid suspension. I also like this product from Paula's Choice, the 10% azelaic acid booster with licorice root. You can use azelaic acid in your morning routine and or in your evening routine. Technically, you could use it 3 times a day if you wanted to. It can be drying, it can sting, but otherwise it's pretty well tolerated. It's also a helpful ingredient for rosacea, and it's a helpful ingredient for hyperpigmentation. So it has multiple benefits. Another option that is pregnancy safe for tackling closed comedones is alpha hydroxy acids. Alpha hydroxy acids include things like glycolic acid, lactic acid, mandelic acid. Now, in contrast to salicylic acid, alpha hydroxy acids don't focus as much in the pores, so they're not quite as good for comedones as salicylic acid, but they definitely can improve them and help reduce comedone formation. But they definitely exfoliate, they dissolve the glue between the sticky skin cells. Here's a product that I am rather a fan of from Neutrogena. It's their Hydro Boost Glycolic Acid Overnight Peel. It's fragrance-free. It has hyaluronic acid, which actually may help enhance the penetration of the glycolic acid. Check out my video though on salicylic acid versus glycolic acid. I go into more details there about formulation and how they really differ. So you're going to want to watch that if you want to learn more about these ingredients. And then last but certainly not least, when it comes to treating acne, you cannot forget benzoyl peroxide. Benzoyl peroxide is comedolatic, so it'll help cut down on closed comedones. It's also anti-inflammatory, and it helps reduce the burden of Cutibacterium acnes. That's the bacteria that plays a role in acne. So it tackles many aspects of acne, including comedones. The problem with benzoyl peroxide is that it can be very drying and irritating, but benzoyl peroxide formulations have come a long way. They're a lot less irritating than they were. This is one from Neutrogena that I'm a big fan of for a few reasons. It's their Stubborn Acne AM treatment. This has 2.5% micronized benzoyl peroxide. The micronized benzoyl peroxide is what helps this be less irritating. Basically, smaller particles of benzoyl peroxide, they get into the pore more efficiently, they spread out on the surface of the skin more efficiently, so they're less likely to be as drying and irritating, and they do help tackle closed comedones. I have a whole video on how to use this, by the way, so you're going to want to check that out if this is something that you are interested in incorporating into your routine. I'll link it down below in the description box. But one thing you need to know about benzoyl peroxide is that in addition to being drying and irritating, the leave-on forms like that, if they come in contact with fabrics like this black blazer I'm wearing here, they will bleach them. So that's something to be careful about. But you can have benzoyl peroxide in your routine 1 to 2 times a day as tolerated. While some retinoids are not stable in the presence of benzoyl peroxide, adapalene, which you can buy over the counter again without a prescription, is. So you can use adapalene and then you can use benzoyl peroxide together for acne. No problem, although the combination can be more drying and more irritating than either on its own. It may be a bit overboard for purely comedonal acne, but for some people it may be what they need to get the results that they're looking for. All right guys, so that's everything I wanted to chat with you all about for today's video regarding closed comedones. They are a common skin concern, comedonal acne. And remember, if you have blackheads, everything I've talked about in this video applies to you too. Same products, same tips, same things to avoid, all of that. Salicylic acid face wash can really go a long way in terms of helping clear up and prevent closed comedones. So on the inside, I'm going to link my video all about salicylic acid face wash. You're going to want to watch that next. I give lots of tips and tricks for introducing this ingredient product family into your routine. But if you guys like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.